I'm the president of the Federation of Palliative Care in Flanders, and about 2 years ago we voted with the Federation, with the board, a text which says that there should be no two rails on the end, two tracks on the end of life, a track of palliative care and a track of euthanasia, that it should be one track, and that we call this track integral palliative care. The experience learns that there is a synergy even between palliative care and euthanasia care. There is a synergy in the sense that you have better palliative care if you have some openness towards euthanasia, and you have better euthanasia if palliative care is also involved.
It's very important to listen to the patient and to respect what he wants, but everything starts with really listening to what the patient wants, and to support him in finding out what he wants, whether that be palliative care, another treatment, or euthanasia.
As a federation, we took the point that you have to care for every patient, also for the patient who asks euthanasia, and that euthanasia is not something awful. In the idea of some opponents, they think euthanasia is something inhuman. That it's on the opposite, it can be very beautiful, it can be a very good form of dying, on the condition that you are very careful.
Clinical experience of my own, and I hear from many colleagues similar experiences, is that when a patient asks two things, when quite a number of more and more patients ask for euthanasia, and then the resistance is very often from the family, right, who really do not want to part rapidly.
That Catholic Church and theology in general is not very fond of euthanasia, and that can be the personal conviction of somebody working in palliative care, whether he is medical doctor or psychologist or spiritual caregiver. The point is, can we listen to the patient and listen what the request of the patient is? I think it's important that from that point of view we listen and respect the autonomy of the patient. Paternalism is very bad.
In the beginning, there were, in the palliative care movement, some who were very resistant because they say we want to have the pure Cicely Saunders care package, so to say, palliative care, and we don't want to do the slippery slope. Also not in our professional attitudes. But the fact is that almost 10 years later, those teams who have this openness do not have a feeling that they are on a slippery slope.
We should be all aware that there are many, many more requests than actually are carried out. And the reason, and that's more and more so, and the reason, most important reason that I can see is that then many patients are quite satisfied with the idea, or reassured with the idea that if and when the time comes, when they express that wish, they will be, it will be honored, so that peace and serenity is promoted.